Really healthy people. Now, who do we have? Let me think. Who's really healthy and elderly, but still incapacitated and need nursing home care? If they're really healthy, why in the world would they be in a nursing home? Alzheimer's. Yes, Alzheimer's are the worst. They don't want Alzheimer's patients. Alzheimer's patients, they'll be in there for 10 years. That's not who they want. Whereas health insurance, Alzheimer's patient applies for health insurance, they're probably going to get insured. But for the cost of the drugs we use now, Aricept and stuff like that, but for that cost, they like insuring health insurance on Alzheimer's patients, but long-term care insurance, no way. You're not going to get it. They're not going to approve it because they don't know. You may last forever. Because we have and I've had lots of clients, quite frankly, who go in with early onset Alzheimer's, 55, 56, and they may be in there 20 years. They're strong as an ox otherwise. Their only problem is that they're impaired. If they could manage their meds, if they could live at home without being in danger themselves, they wouldn't be in the nursing home. They're there not so much because they need help getting around or help with the typical activities of daily living, bathing, transferring, things like that. They need help because, doggone it, they're liable to burn themselves on the stove. They're liable to wander off and never come back, go into traffic. It really has less to do with the finer points of skilled nursing. It has more to do with the fact that they're a danger to themselves and they've got to be in a secure environment. Okay. So we have to look at our risk when we decide to buy long-term care insurance. Does our family have a history of Alzheimer's or dementia? If they do, you probably want long-term care insurance, and you probably want to buy it young. Most experts are now saying age 50. Age 50, you should start looking. Some will say in the 40s, but I'm too young to be looking at that insurance, so I don't listen to those guys. But seriously, most people say 50, and some experts now say late 40s. But at that point, you can still get a reasonable premium. So, we want to, as part of our planning process, as part of preparing for the point at which we're going to be incapacitated, if ever, we want to make sure we have made plans for long-term care. And so long-term care insurance is a possibility if we can afford it. It is very difficult to afford, and most experts are saying no more than 5 to 7% of disposable income. Well, for most people, 5 to 7% of disposable income is not going to buy you long-term care insurance. It's just not yet. Now, maybe with this, maybe with the Class Act in place, maybe we'll have so many more people in that pool, okay, that in fact the costs will come down. So, long-term care insurance is a possibility. If we're looking at this kind of risk, many people will say, you know what, I'm not going to bother with long-term care insurance. I'm not going to bother with any kind of government program that might pay for my long-term care. I'm just going to private pay it. I'm just going to pay it out of my pocket. That's what it costs. That's what it costs. I'm just going to pay it.
You get my rate.
Yeah. And you may get this rate. That's exactly right. Depends on where you are. You might get that rate. It's possible. But not if you're a Medicaid certified facility. So you might decide to private pay. So what's your third option if you don't have long-term care insurance? I should say a little bit more about long-term care insurance. Real quickly, the things that we have to be careful about on long-term care insurance is that the policies vary widely. You need to read them carefully. There are specific policy terms that you need to be aware of. And so, for instance, one is the term of the policy. That's the length of time it's going to pay benefits. In light of what I said about average stay, how many years of benefits do you think you want? In light of what we said about average stay, we want to buy at least how many years of coverage? 2.5. But you can't buy them in half years, so we want at least 3 years of coverage. Policy, you want to look at what triggers the policy. You want to make sure policies will have activities of daily living listed. Transferring, toileting, bathing, cooking, medicine management, etc. as activities of daily living. And most policies will require you, from the list that they provide, to have failed a certain number of activities of daily living. So you want a policy that has a long list of activities of daily living, and you want to have to fail as few of them as possible. So you want your policy to trigger easily. Okay? You also want to make sure that there is a premium waiver once you qualify. So you shouldn't keep having to pay premiums. Once you reach the point where you qualify and benefits start to pay out, you shouldn't be paying premiums anymore. This may be the most important one of all, which is you want to have some kind of inflation protection on your policy. I have lots of clients who come in and they say, I've got this great policy, I got it through my employer, it was really affordable, it was the best one on the market at the time, and you're like, terrific, when did you buy it? And they're like, 1985. And you just know what's coming. You're like, all right, well, let me see it. And you get the policy out, and it's $40 a day. And you're like, you know, I applaud your planning. I applaud the fact that you thought ahead. This is going to pay 1/3 of your cost, and the rest of it you're going to have to come out of pocket for. So we want to have inflation protection so that the amount that it pays automatically goes up every year. And so what you're going to have in these policies is you're going to have a daily benefit amount. And right now, we're suggesting no policies with an amount of less than $150 a day. If you can afford to buy a policy that's a little bit above the current market rate, we want to do that. Because it'd be better if you started a little bit ahead of the curve. You know that it's going to outpace inflation. So we want some inflation protection, and according to Alabama law, if you offer it in a policy, it must be no less than 5% compounded. So if it's $150 per day benefit this year, next year that benefit's going to be $157.50. And the next year it'll be a 5% increase over that. So it automatically goes up every year. There is also the option, there's also optional inflation protection, but you can imagine you're going to pay a lot of money. Okay. So you want to negotiate it on the front end of the policy. You want to get inflation protection so this amount goes up. So some policy terms that you need to look for. Now, let's say that you don't have a whole bunch of money, and you did not buy long-term care insurance, and you're at the point where you need to go into a skilled nursing facility. How are you going to pay for it? What's left?
If you're over 65, you have Medicare, and you receive Social Security, don't those benefits get assigned to the nursing home?
No. There is a limited, and it's a good thought. There is a limited benefit. Subsequent to a hospital stay of at least 3 days, if you're discharged into a skilled nursing facility for purposes of rehabilitation, you get 20 days. Now, beyond that, you can actually get up to 150 days if you have Medigap coverage and some supplemental policies. But usually Medigap coverage will pay. Because what happens is from 21 to 150, Medicare is going to pay, but they're only going to pay about $15 a day. And the balance is considered a copay. Yeah. It's like reverse, you know? It's like the copay is what they ought to pay, and what they pay should be the copay. So if Medicare is only good for 20 days, what's left to pay for nursing home care? Medicaid. Medicaid is it. Now, the way that this usually comes up in my clinic is that I have a son or daughter come in with their mom. They say, Mom's got to go in the nursing home. Doctor says she can't live by herself anymore. She can't manage her own bed. She needs help bathing. She's got to go in the nursing home. We're going to admit her, but before we admit her, she wants to deed us her house. She would like to deed us the house. And so whenever I get a question from a family member about deeding a house out of Mama's name, if you get beneath the surface, it's never just because Mama has all of a sudden decided it'd be a good idea for Jim Bob to have the house. It's always because they're anticipating nursing home care on the horizon, and they say they don't want the government to get it. I don't want the government to get it. And what they're really talking about is Medicaid. Because in order to qualify for Medicaid nursing home benefits, which is the only government program that is going to provide an unlimited benefit for nursing home care, you must be medically, income, and asset eligible. Okay? Now, to be medically eligible, your doctor must certify that you need skilled nursing facility care. Okay? You must be a resident of the state or intend to be a resident of the state, and you must be in the nursing home for at least 30 days. Once you're in the nursing home for 30 days, Medicaid will consider your application. You must be income eligible, which means you must make no more than $2,022 per month. Now, this counts only the applicant's income, but it counts the applicant's income from all sources. So they want to make sure that this benefit is preserved only for those people who are really in need. Okay? So they set an income cap on it. Now it stands to reason, if you're making $4,500 a month or more, you probably don't want to apply for Medicaid. Just pay it. Just pay your income over every month. Just pay for your care. That way you don't have to worry about all these other eligibility requirements. But let's say you're not. But let's say that you make $2,500 a month. I can fix that. I can fix that. So, before I get into a little bit more discussion about Medicaid eligibility, let me tell you how it works essentially. The fact that you are income, asset, and medically eligible for Medicaid, and you qualify, means that this is going to happen. You're going to go into the nursing home, and each month you're going to pay over to the nursing home all of your income. They're going to put $30 in a patient account for you for your personal needs. Apparently $30 for the last 7 years is the amount that you need each month for all of your personal needs. I don't know if you knew that, but for those of you spending more than $30 a month, you're spending way too much. So rein it in, folks, rein it in. So they're going to put $30 in a patient account, and they're going to apply the rest of your income towards your bill. The remainder of the bill is going to be paid for by Medicaid. What that means is you will never have income again. But it also means you will never have a medical need again. Food, shelter, prescriptions, medical care, it's all inclusive. It's a turnkey package. It's an all-inclusive, cruise, one price per day. That's got it. Okay? So, if you make more than the maximum amount you can make per month, Medicaid doesn't really care. But what they'll say is you must pay that into a qualified income trust account, and out of that account you must pay every month $2,470 to the nursing home, and you may keep $30. And once again, Medicaid is going to pay the difference between what you paid out of your qualified income trust account and the cost of care. So I can fix you if you have too much income. What I can't fix is if you have too many assets. And your assets, okay, which includes, by the way, your spouse's assets, and it doesn't matter how those assets are titled. It doesn't matter if they're solely in your spouse's name. We still count it. $2,000 in countable assets. Now, when I say countable assets, I say that because there are some things that won't count. So, a life estate in property, which is the right only to live in the property, doesn't count. A home, if the spouse